Hey there, and welcome to another Health Essentials podcast. I'm John Horton, your host. Every 40 seconds, someone in the United States has a heart attack. How you respond to that situation can mean life or death. Acting quickly can limit damage to the heart and improve the chance for survival and a full recovery. Every second counts. That can't be emphasized enough. So today, we're going to learn how to maximize every tick-tock of the clock from cardiologist Jacqueline Tamis-Holland. She is one of the many experts at Cleveland Clinic who visit our weekly podcast to talk health. Now let's get moving on learning what to do if someone is having a heart attack. After all, we don't have time to waste. Welcome back to the podcast, Dr. Tamis-Holland. Thanks for joining us again for a little ticker talk.
Thanks, John. I'm really happy to be here today. Thanks.
So let's start with just, I guess, a basic truth, and that's heart attacks are terrifying to even think about for most folks. It just has such this kind of game over feel when it comes to life. I'm guessing you field a lot of worried questions from people on the topic.
For sure. Yeah, we see a lot of concerns and a great spectrum of the concerns that people have regarding it.
Yeah, and you always, you worry that that's it. Like you're gonna have a heart attack and just drop, and that's it. Is it that bad, or do we kind of fear it maybe more than what we should?
Yeah. So I think a heart attack is extremely serious compared to what it was maybe 50 years ago when we had less therapies for it and we were less aware of what was going on. I think it's a little less serious than it was 50 years ago, but it is still an extremely serious problem. I would say the range of how serious it is will depend on the severity of the heart attack.
Yeah.
So it can range from a very small leakage of heart enzymes because of a very small damage that's not even noticeable on an echo to a severely blocked major artery that leads to severe heart muscle weakness. And so the seriousness of it will depend on the type of heart attack you have, but it's certainly not the type of thing where people feel like, oh, you won't survive the hospitalization. Well, most people do perfectly well, and survival is well over 95% at 1 year or so forth.
Oh, that 95% is a good number. So that's something that should make people feel a little better about your chances of walking away from it, which I think is what we all kind of worry about. And this is going to sound stupid, but can you just define kind of what a heart attack is? Because I think sometimes people get confused with that, with cardiac arrest, and they just know it's bad. So what exactly is happening if you have a heart attack?
For sure, I would like to tell you that because I think that is a major misunderstanding among patients. So a heart attack is a situation in which there's a blockage in the artery or there's temporarily poor supply to the heart muscle because of poor blood flow to the heart muscle. Most often it's due to either a temporary blockage in an artery that has a severe blockage and it's temporarily totally closed, or a total closure of the artery that lasts for a long period of time. And so when the artery closes up, oftentimes it's due to clot, there's no blood flow to that part of the heart muscle. Okay. And if it's a large artery, you will not have blood flow to that heart muscle. And over time, if you wait too long, that heart muscle can die. On the other hand, a cardiac arrest is when the heart stops. So arrest means stop. Cardiac arrest means the heart stops. The heart stops for any of a number of different reasons. Sometimes it stops because of a fatal arrhythmia because of a heart attack, but other times you can have a serious arrhythmia for other reasons, and the heart will stop for that reason. So a cardiac arrest is different. That is much more serious. And if you have a cardiac arrest, that's what probably people fear so much, because unless you get to the hospital and immediately get resuscitated, the survival is very poor.
Okay. So with a heart attack, I mean, your heart is still doing the thump, 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 thump. It's just there's a clog just somewhere in the pipes there.
Exactly. So that's exactly it. So your heart's still pumping, you're still breathing, you're awake, you're still doing all of the functions of your body. It's just that part of the heart is not getting good blood flow. And with a cardiac arrest, the heart just completely stops functioning. You need something to either make it start again or CPR to pump on the heart to supply blood to your brain until your heart regains function.
Now, taking action when someone has a heart attack, it begins with knowing that they're actually having it. And I know, Hollywood has put this image in our heads that people just, fall over and it's like this big dramatic scene. Is it that dramatic or is it a lot less than that?
Yeah. So if let's talk about heart attacks, because we talked about cardiac arrest. That is a big dramatic scene. You do collapse.
Okay.
But with heart attacks, usually it's actually much less dramatic than they show in Hollywood. And I think that is the problem, because people come to the hospital because perhaps the patient doesn't want to go and their wife tells them to go or their husband tells them to go. And they oftentimes say, we'll use the word pain and we'll ask you, well, when did the pain start? And they'll always tell us, I'm not having pain, because it's not pain in their minds. It's discomfort or a pressure or a burning. So because it's not pain, they don't realize they're having a heart attack. So it's not usually dramatic. You can usually have a pressure-like sensation, maybe burning or squeezing or aching. It could be in the belly, upper belly area. It could be in the throat area. You could have signs that go down the arm, but it's not usually as dramatic as they see on TV. And it's severe and very uncomfortable, but it's not that intense stabbing pain that you see on TV when they have those types of scenes where somebody's having a heart attack.
Yeah. And, I think that's where we get to exactly what you were saying before, the difference between a heart attack and cardiac arrest. And I think what Hollywood shows us is the cardiac arrest, and then they call it a heart attack later. And, and then we have to correct everything on podcasts like this.
Exactly. But they're both not good. So
yeah, they all need attention. So, and when we're talking about heart attacks too, we often hear that men and women kind of have some different symptoms. So I want to make sure we kind of touch on that a little bit, so that way people know that there might be some different feelings going on.
Yeah. So women are, the most common symptom in women is chest discomfort and chest pain, just like men. They're both the most common symptom in both women and men are equally chest pain. But women are more likely than men to have some atypical features as well, or alone. And that can include just shortness of breath or just nausea, sometimes just epigastric pain, so pain in the upper part of your belly. So they don't recognize it as the heart because it's in the belly area or in the stomach area. They might have some back pain or some jaw pain. So women are more likely to have atypical symptoms, but in truth, women and men equally have chest pain as well.
Yeah. And I always have a hard time wrapping my head around this idea that people have a heart attack and don't really know it. They talk about silent heart attacks, or people have one and they don't, go seek care for, hours or even, days. Can they really be that mild where you barely notice you just had a heart attack?
For sure. I mean, sometimes it's so mild you've had that heart attack and they find out months later by just doing an EKG and seeing an abnormality, and you didn't even realize it. And sometimes in retrospect, you remember, oh, maybe I had a symptom of indigestion. Maybe that was it, and didn't realize it. But sometimes people can't even recall an episode. We have lots of patients who come in and, I hate to use the word silent because it's not silent, right? They're having some symptom, but they come in because they have, especially our patients with diabetes, they come in with intractable nausea and vomiting, and it won't go away. And I've seen a couple of patients with a big heart attack that their only sign was that they had terrible nausea and vomiting and very high sugars. Sometimes, but it is a symptom. Yeah. It's not silent. And then sometimes people just have diffuse sweating and, again, nausea. And sometimes people just have shortness of breath. So it's not silent because there is a symptom, but it's not the symptom you'd expect.
Maybe we need to try to get the term whispering heart attack out there, because it sounds like, it's saying something, but you have to listen to it.
Exactly.
All right. So if you're in a situation and you start, either yourself or someone you're with starts showing some of these symptoms, that pressure in the chest, sweating, nausea, just that feeling that, man, something is not right. what are the first things you should do? What should happen right away?
So if you're feeling like something's not right, and you know something's not right, you really should be calling 911. We always say that if it's more than 10 minutes, but even if it's less than 10 minutes and you think something's not right, you should call 911. Certainly, first call 911, but then if you have a neighbor or a friend or a family member that's nearby, then you should also let them know so that they can immediately be with you if you are alone, so that somebody's with you. But don't take the time, because we see this all the time, to call your family member first so they can come over and then call 911. You should always call 911.
Okay, yeah, get the medical care first. Call, the kids or parents or everybody else later.
Yeah, and then just sit down in the chair or in the bed, try to lay down, try to relax. You can certainly take an aspirin of 325 milligrams or 481 milligrams or whatever, but the ambulance, if they arrive, or if you go to the hospital and you see somebody in the hospital, they'll give you the aspirin, but you can certainly take it. It's probably not going to abort a heart attack, but you can take, because that's going to be your treatment anyway.
Let's talk about some of those things you can do after you call 911 and you're waiting for those sirens to get there. You had mentioned taking an aspirin, and I want to make sure we emphasize there, you mean aspirin. We're not talking ibuprofen, Advil, something like that.
Yeah. So you're taking the aspirin not to take the pain away. You're taking the aspirin because it's an antiplatelet, and it can sort of block the platelet activity. And part of the way the heart causes clotting in the arteries is through the activation of the platelets. So by inactivating the platelets, it can help sort of treat the heart attack. It really doesn't abort it, but it can be helpful. And we just typically, that's a standard treatment we give. Motrin, Tylenol, Advil, they don't have the same antiplatelet effects. They might help with pain, but that's not why you're taking the aspirin.
Now, what about, you had mentioned maybe laying down. I mean, does it matter what kind of position you're in, or should you just get in any position where you're more comfortable?
Yeah, actually, that's a great point. You just stay comfortable and stay still. Don't, if you're walking around, you're saying, let me try to walk this off, or getting up and, let me clean my house before the ambulance comes.
My wife would be doing that. So we got to pick up a little bit before they get here.
Exactly. That happens to many people. So just sit down and relax. And you're right. Maybe sitting down is more comfortable than laying down, because if you have a big heart attack, you might not even want to lay down because you'll be too short of breath. So certainly whatever you're comfortable with, you should be doing.
Yeah.
But try not to, do too much movement and running around.
Is there even things where I've read where, you should loosen up, tight clothing, or I don't know, you take a belt off, things like that. Does that help, or is that just more kind of feeling comfortable?
I think you feel more comfortable. I don't really know if it makes that much of a difference, but certainly if you've got a million pieces of clothing on, they're going to need to take that off to do an EKG and to take care of you and put an IV in. So perhaps starting to take off your 3 sweaters you have on will help. So that way when the ambulance comes, you're sort of ready and they can easily take your shirt off and do an EKG and put an IV in and so forth. But I think the loosening of the belt and opening of the shirt, it would just maybe make you feel better.
Now, what about, we talked about CPR. Is that something that usually gets done with a heart attack, or is that more of a cardiac arrest thing?
Yeah, no, that's cardiac arrest. Okay. So if you're having a heart attack and your loved one, you're with them, you're waiting for the ambulance to come, and then all of a sudden somebody's having chest pain, and all of a sudden they become unconscious and unresponsive, then you are going to want to check for a pulse. Obviously, 911 should be on the way. If they're not, you should be calling them. And then you will start CPR. And most of the time, the 911 can give you information. So if you call them, they will be able to explain to you how to do CPR. They will literally take you through it step by step. They're trained to instruct you on how to give CPR to your loved one. So if somebody's unconscious and doesn't have a pulse, that would be the treatment, CPR. That's for a cardiac arrest.
Okay. All right. So we want to make sure CPR is not something you automatically trot out where you tell somebody, hey, listen, lay down now. I'm going to start giving you CPR. If they can talk, they're good.
Do not do CPR on an awake person who's talking to you and saying you're having chest pain. You will make it worse. Do not do CPR unless somebody is unconscious and doesn't have a pulse. You check for a pulse and you don't feel it.
All right. And if they're asking for it, then you got to start questioning what's really going on, I guess, So what about, you always see too, AEDs, and those are for cardiac arrest also, right?
For sure. And I'm so glad we're talking about this, because this total distinguished. You do not, if it's just a heart attack, you do not want to apply an AED, and you do not want to do CPR if it's just a heart attack. So for a cardiac arrest, if somebody is unconscious and they don't have a pulse, then, and if there's an AED around because you're in a restaurant or a public place, then what you would do is you would follow the instructions on the AED. You usually put the paddles or whatever the pads up to the chest, and the AED will tell you, do nothing or deliver a shock. It will tell you, you're not going to deliver a shock. I don't even think the AED can deliver a shock unless it sees a rhythm that should be shocked. So it'll give you the instructions and you follow the instructions.
That's a good point of emphasis though, because you don't want people just breaking out that tool because they think there might be a heart attack going on and the person's fine. Like in case of emergency, if somebody's out, they have no pulse. That's when you start breaking that out.
Exactly. Two totally different things. That sometimes a heart attack can lead to a cardiac arrest, but two totally different things. And people just confuse it all the time.
Well, and that's where it's important. Like you said, if a heart attack can lead to cardiac arrest, that's why you do need to call 911 and get people in there in case it starts to escalate. And you want to make sure you have the right people there to take care of the situation.
Exactly.
So, how important is it to have like a heart attack action plan? I mean, you hear people talk about this. Is this something you should do only if you're kind of maybe a higher risk person? Or is it something maybe everybody should have a little idea in their head?
I think it's not so much an action plan, but I think that everybody should recognize that they're not immune to a heart attack. And if they feel symptoms that doesn't feel right, they should pay attention to those symptoms and recognize that this could be serious. So, I don't know, like you have to have an action plan, like what happens if there's a nuclear bombing in New York City and what do we do and what's our action plan? What you really want to do is just be aware that if you're not feeling well, that I'm going to call 911 or my family member is going to, stay with me or whatnot. But I think it's more important that you should recognize that you are at risk, and everybody is potentially at risk. I'm going to say, I'm going to emphasize to you that everybody is at risk. I saw a 23-year-old woman who had nothing, no family history, no diabetes, no high blood pressure, no high cholesterol, nothing, who had a heart attack, did have a cardiac arrest from the heart attack, collapsed, and her roommate gave CPR. And she had severe blockages in all of her arteries. So anybody is at risk, and you cannot just say, oh, I don't have diabetes, or, oh, I don't have high blood pressure, or, oh, there's nobody in my family with a heart attack. Therefore, this pain I'm having, this discomfort is not my heart. I think everybody needs to recognize that it can happen to you. And so to recognize that if you're not feeling well, if it's not right, you should call 911.
Yeah, listen to your body. I mean, I can't tell you how many times we've said that on this podcast, but I mean, we keep saying it because it's true.
Yes, for sure. You have to let your body tell you this isn't right.
So what would be your top tips for improving heart attack survival odds? Because in the end, that's what we all want to do. We want to be able to talk about it afterward because we want to still be around. So, how can we make sure that we, can tell that story?
Yeah, so I'm going to sound like I say this again and again, but it's basically seeking immediate medical care. About 30% or a third of heart attacks are from a complete blockage to the artery. That's called a STEMI, and that requires opening of the artery. That's the only treatment for it. And generally, we open the artery with a balloon and a stent, doing an invasive procedure called a cardiac cath and placing a stent. And the sooner you get that artery open, the sooner you restore blood flow to that heart. But with each passing minute, the heart muscle gets damaged because it doesn't get good blood flow, and over time that part of the heart can die, get so damaged it can die. And so the trick to taking care of yourself and surviving this heart attack is to get immediate care, so we can open that artery.
And when you say part of the heart can die, is that just like you're talking then forevermore, you're going to be at, maybe 80% heart capacity or something like that? It's just always going to kind of be there, and you're going to be a little limited?
Yeah. So, it depends on the heart attack, and it depends on how long it's been closed for and how big the artery is. But generally speaking, if your artery is 100% blocked and it's supplying the heart muscle, generally speaking, after about 30 minutes, you start to see your 30 minutes, you start to see damage, and that damage could be permanent. But it depends. Sometimes it's just transient because the body has other channels to supply blood to that area. Those are called collaterals. And so it may not be permanent damage. It could be stunning. You don't know that until you've given it time to get medications to see if the heart recovers. So sometimes it's permanently damaged. It's done. That part of the heart will never function again.
Wow. Well, and this seems then like a perfect time to emphasize too, that we can all help prevent our own heart attacks by just kind of adopting a heart healthy lifestyle. So what are your top tips there? If we want to make sure we don't have to come see you for medical care, how can we best avoid that?
Yeah, so I would say that for sure, everybody, whether you're at risk for heart disease or not, should follow a healthy lifestyle. And that includes regular exercise. It should be moderate intensity aerobic activity, about 5 days a week for 30 minutes at a time, or about 150 minutes. And that's what the American Heart Association recommends. In addition, you should eat a heart healthy lifestyle, heart healthy diet. And that would include, for me personally, I think the best example is the Mediterranean diet. I don't mean that if you're 30 years old, you can never have a piece of a chocolate brownie, or, no matter how old you are, you can never have a chocolate cake or whatnot. Of course, you can have it with moderation once a week, once every 2 weeks or whatever. But in general, you should be following a heart healthy diet. And that, I think, the Mediterranean diet is great because it emphasizes fruits and vegetables and whole grains, and avoidance of fried and fatty foods and things like bacon and animal fats.
Anybody who listens to this podcast has heard that a lot, because we spend a lot of time. We have our resident dietitian, Julia Zumpano, is on here all the time, and we break that down and exactly what it means to eat healthy, and you need to eat with nutrition in mind. For sure.
And then importantly, you should maintain a healthy weight, and you should also make sure that you don't smoke, because smoking really can increase your risk for heart disease and heart attacks. That's for everybody, yes, no matter who you are. But then on top of that, you also should go to your doctor and find out, do I have high blood pressure? Do I have diabetes, or do I have high cholesterol? Because these things are silent. You might not know you have high cholesterol or high blood pressure because you're not going to feel differently for the most part, even if your blood pressure is high, or your sugar is high, or your cholesterol is high. And so you want to make sure that you have those things checked with your doctor. And if they are abnormal and you do have high blood pressure or diabetes or high cholesterol, you want to address them and make sure that you follow a diet, or you get medications to treat that so it's under control.
Yeah, it sounds like there's a lot we can do to really minimize our risk, but you've got to focus on it and pay attention.
Yep, for sure. That's what it is. You just need to be aware.
So I have to tell you, with everything you've said, heart attacks, they still seem scary to me. I'm going to be honest, but I do feel better after hearing everything that you said, as far as, what your chances of survival are, and things you can do ahead of time and while it's happening to make sure, that you do live through it. There's just a power that comes with feeling prepared. And I guess that's kind of the whole point of this chat.
For sure. And I think that's, you say the word, you need to be prepared. So you need to just be aware. I don't want you to constantly be thinking about it 24 hours a day, but you need to be aware that there is a potential. And so if something's not right, you want to recognize that this could be a heart attack, and maybe I should look into it.
Don't ignore your heart telling you something.
Yes, exactly.
All right. Well, that seems like a fabulous point to end this on. And Dr. Tamis-Holland, thank you so much for making some time in your day to come in and talk with us. I know how busy you guys are there, so we appreciate it.
Oh, yes. I'm thrilled to be able to tell you, especially on the difference between heart attacks and cardiac arrest, because they are distinctly different. So happy to be here. Thank you for having me.
Thanks so much for coming in. If you or someone with you shows signs of a heart attack, dial 911 and get help immediately. Time is muscle, and the longer you wait to get care, the more damage can be done to your heart. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.